And she's, as I mentioned, she's our one of our Lymphoma Care Nurses from Queensland and is based just outside of Brisbane. Rebekah completed her Bachelor of Nursing in 2014, and she started a nursing career with the bone marrow transplant unit at the Royal Brisbane and Women's Hospital. And then she commenced a role with at North Lakes in the day oncology unit for a few years there. After and during that time, she also started at the Queensland Children's Hospital as well on the bone marrow and oncology unit there, where she still works part-time and has joined our team part-time as well. So I'd really like to welcome Beck. Hi,
Thanks,
Beck.
Donna. Hi, everyone. Thank you so much for having me again, take two. It's really lovely to be here. I will share my screen and we can get underway. So we're going to be talking about fatigue and lymphoma today. So thank you everyone for tuning in for Lunch with Lymphoma. As Donna mentioned, fatigue is a really common side effect that a lot of people experience who have lymphoma or cancer in general. And so it's an excellent topic for us to be talking about today. Before I get started on this definition and go forward, I just want to acknowledge that one of the wonderful occupational therapists at the Peter Mac Hospital, Olivia Warner, she actually put together this slideshow presentation. So a lot of research has obviously been done around fatigue management in cancer and also in lymphoma. And so these slides actually are credited to her. She's kind enough to let me use them. But yes, I just wanted to acknowledge her before we went any further. But what is lymphoma-related fatigue? So as you can see the definition on the screen there, lymphoma-related fatigue is persistent physical, emotional, and/or cognitive tiredness or exhaustion related to lymphoma and lymphoma treatment. It is not proportional to recent activity. It is distressing and it interferes with usual functioning. And unlike everyday tiredness, it actually cannot be relieved by sleep or rest. So fatigue can be experienced throughout the entire treatment journey. Most people find they begin to recover from their fatigue after about 6 to 12 months completing treatment. So some people can actually experience fatigue for a longer period of time than say 12 months after treatment. This isn't always the case, but some people even do report never fully returning to their original energy capacity. And fatigue can be very severe and distressing, and it often is considered to be one of the most distressing symptoms that people experience in their diagnosis and post-treatment as well. Because people in fatigue, the thing is, people look very well on the outside, and for all intensive purposes, they perceive themselves to be healthy, you know, particularly when you've completed treatment. Your hair might be growing back, you know, you've put on weight again, or you're feeling a bit better, projecting yourself a bit better, but then you actually feel really fatigued and really out of energy. And so it's really common that family members and friends and colleagues underestimate just how severe and how enduring fatigue can be related to lymphoma and other cancers as well. People do kind of expect that once your treatment is finished for lymphoma, you just magically recover and suddenly you go back to normal and you've finished treatment for lymphoma and now you can carry on with your life as it was before this whole lymphoma experience. But unfortunately, a lot of people say that fatigue actually lingers beyond the completion of their treatment. And that can be really alarming when people are eager to put their cancer journey behind them and move and return back to some sort of normalcy. But there is actually a spectrum of fatigue as well. So there is what we call mild, moderate, or severe fatigue. And mild fatigue is when you're noticeably more tired, but you're still able to continue everyday tasks and activities. Moderate fatigue would be when you are obviously more fatigued and it impacts your capacity to complete daily activities and you are reduced in the amount of actual activities you're able to complete. And then severe fatigue is when you're unable to complete any day activities, you know, getting up, even sitting up sometimes is too much effort, is when that can be really severe. So people can experience mild, moderate, or severe fatigue at any point in their cancer-related journey or their diagnosis and treatment of lymphoma. So let's jump across. So what causes fatigue in lymphoma? So each of these causes that we have on the screen here details a little bit of the various experiences that people might have. And every single person's journey is actually going to be different, and different factors will contribute to a person's experience of fatigue. And patients often do report these four common, I guess, areas. So the cancer itself, so the lymphoma itself can cause fatigue in its own way. The lymphoma itself puts strain on the body, and so that can cause fatigue. The emotional upheaval of a lymphoma diagnosis. So you can just imagine how distressing it is for you when you find out that you've got lymphoma and you've got to go through that whole upheaval of your life and routine. That can be very fatiguing. It can stress you out. Additional stress can be a cause for fatigue. Lymphoma symptoms as well, such as pain or breathlessness, and other coexisting medical problems are all factors that can contribute. There's also obviously treatment. Once you start treatment, the side effects of treatment, including your radiotherapy treatment, chemotherapy, immunotherapy, antibody therapy, all of these treatments impact our body. We put a lot of different toxins and a lot of different chemicals in our body in the process of treatment, and that is really wearing on the system, and it can cause fatigue. Not to mention the side effects of some chemotherapies being your red cells go down, your hormone levels are shifted, your appetite and your nutrition is impacted. All of these side effects can contribute to a person feeling fatigued. So most times when people do feel fatigued, there's not one single answer. You know, most times your doctor doesn't say, oh, this is exactly the reason that you are fatigued. It's often a combination of multiple factors that contribute. The length of time that treatment takes and the impact that this has on different people is definitely an indicator for fatigue as well. So people have different treatment regimes depending on their type of lymphoma, and the endurance of that treatment regime can cause fatigue as well. It is thought that fatigue may occur after treatment because the body needs extra energy to repair and heal, and there is a buildup of chemicals as the cancer cells are destroyed, and also the medications that we give you are being just excreted throughout the body's systems. So the body's immune system is also impacted as well. So all of those things included, it is about 70 to 90% of cancer patients that report feeling that they experience fatigue during their cancer journey or their lymphoma journey as well. So we mentioned some of the fatigue, some of the symptoms of fatigue just before, and this is a bit more of a discussion about fatigue. So on the screen here, we've got a few dot points that detail common symptoms that people might experience, but also aside from that, people might feel like they are experiencing pain that they're unable to control. So uncontrolled pain can be very fatiguing. That overwhelming tiredness, reduced physical performance, needing to sleep more than usual, all these things can contribute to you being fatigued. They can be symptoms and signs that you are feeling fatigued. And as I said earlier, fatigue is not an outwardly expressed symptom. It's not like a bruise that you can see really obviously. And so sometimes people don't realize that they're actually experiencing fatigue because, again, fatigue can be mild, moderate, or severe. So because there's a spectrum and because it's not always obvious, people can be trying to deal with fatigue and not even able to identify that, it's fatigue that I've been battling this whole time. So not being able to sleep well. People might not be getting good enough sleep at nighttime, or when you do sleep, you're wakeful or you're stressed about your diagnosis and the treatments that are coming up. All of these things can contribute. Also nutritional factors, so poor oral intake. You know, if you've got a reduced oral intake, if you're feeling like you're not very hungry, all of these things can be symptoms of fatigue. And again, every single person's experience is going to be different. So every person will have different symptoms and different signs that indicate their fatigue that they're feeling. And so it can be hard to just pinpoint and put your finger on the exact thing. But it's definitely a common symptom that, 70 to 90% of patients do experience. So not only is fatigue physical, but it also can be cognitive. So a lot of people might be familiar with the whole chemo brain concept. So this mental fogginess or sluggishness, difficulty maintaining concentration and focus, your inability to think clearly, difficulty making decisions, memory changes, and difficulty multitasking or processing information. So these cognitive symptoms are just as exhausting as physical symptoms as well. So while one person, their experience of fatigue might be that they physically sleep a lot more, someone else's experience might be that they're mentally just drained. They don't have the same sort of energy and capacity to interact and engage with conversations. But it's so important for us to remember that both physical and cognitive symptoms all can affect our daily activities. They all can affect our life, our study, our work, relationships, or things that you normally enjoy. For instance, reading or watching TV. Even these things can be difficult. And that's why it's so important. That's why here at Lymphoma Australia, we wanted to put on this presentation about fatigue, because this is definitely a side effect that so many people can relate to, and yet it's not always given the attention it deserves, because it's not a quick, easy fix for it. Unfortunately, it's not just like, oh, nausea, you take something for your nausea and you clear up the nausea. You can't just magically take a pill necessarily to get rid of your fatigue, and it can be a more enduring symptom as well that goes on beyond the completion of your treatment. So we're going to talk about some, I guess, concepts around fatigue and how we can manage that. And so one of the great ways that the OT department at the Peter Mac have come up with discussing this is called the energy envelope metaphor. So what they use this energy metaphor for is that, say, for example, on the left-hand side of the screen, you have a larger envelope, and then on the right-hand side of the screen, you have a smaller envelope. So that larger envelope is what represents your energy capacity before your lymphoma diagnosis, before treatment, before fatigue started to set in. So at one point in your life, you were able to fit all of your daily tasks and all of your responsibilities into this envelope in a nice, orderly fashion, and you could close the envelope and it wasn't going to be much of a problem. But now, unfortunately, because fatigue has impacted your life, your capacity, your overall capacity to achieve and work is actually reduced. So you've gone from having that larger envelope size to actually having a smaller envelope size. And so now you can't actually fit in all the exact same things that you used to do. And this is a really good picture and a really good concept for us to start imagining and putting, I guess, a picture to how our energy levels have been impacted. Because a lot of people try and squeeze all of the same things that they used to do into their envelope, but they don't realize that their energy and their capacity is actually shrunken now. So we're actually now living with a smaller envelope, which is not a bad thing. That is not a bad thing. Like, it is frustrating, definitely, as a patient. Like, that is a frustrating adjustment to have to make for anybody. But this is the reality when you are managing your fatigue. That is a reality, is that you actually have less capacity than what you used to have. And that is okay. It is okay that you have a less capacity and you need to do things differently. So we talk about the 75% rule. So only using 75% of your energy, 75% of that envelope's capacity. So instead of filling that envelope to 100%, you're going to fill it to 75%, which means that if you're only filling your envelope to 75% every single day, then you have an extra 25% in backup, in storage, which means that if something unexpected comes up, you have that reserve to be able to accomplish those things. So if you do have children and you've organized your day to use 75%, and then one of your children gets sick and you've got to go pick them up from school, then you've got 25% reserve where you can make that outing. You can do that trip, and it's not going to put you over and above your 100% capacity. So that's a really good framework to try and use when you're organizing your daily and weekly schedule, is to think, okay, I want to aim to use 75% of my capacity every day so that I have 25% in reserve for when unexpected things occur and I need to be pushed outside of what I originally planned to do. Whereas if you use all of your capacity 100%, then if something unexpected happens, it can really push you over the edge and wear you down more than what it needs to. I'm just checking my notes here. Yeah, so perfect. So looking at the 75% rule, leaving 25% in case unexpected things occur in reserve. So you avoid purposely draining your battery, as you can't keep adding to your to-do task or overfilling your envelope. You can only fill your envelope to 100%, so aim for 75 so you have an overage. It's about giving yourself some margin. So tips on how to do this. So how do we even fill our capacity to 75%? How do we even know what 100% is for us? So what we like to do is we think that it's really helpful that if you divide your energy and your tasks into low energy, medium energy, and high activity tasks. So this first strategy to implement is to try and, I guess, categorize your activities that you're responsible for and how much energy each of these activities require. Being able to identify this by placing them into a high, low, or medium category is really helpful, because it means that you can organize those tasks in a day or in a week according to your energy levels in that week. So it's all about planning, I guess, in a way. It's about understanding and trying to figure out what works for you and then making a plan accordingly. So, for example, you might see that watching TV is a low activity task, and you see that vacuuming is a medium task, and then cleaning the car is a high energy task. So those three tasks are divided up, and you know that this week you want to do all of those things. You're going to watch TV, you're going to vacuum, and you're going to clean your car. And so being able to categorize them into low, medium, and high means that you can spread them out throughout the week or even throughout the day. If you know that at the beginning of the day you have the most amount of energy, then you might try and do the highest demanding activity first, so that you can get it over and done with. And then you can have a rest and then do medium and low energy stuff, so that by the end of the day, you don't have these really big demanding tasks weighing on your time. Once you've identified your activities according to high, low, and medium energy requirement, we can then move on to what we need to do to optimize our energy intake. So we talk about the baseline energy test. So how much can you do before you start to get fatigue? So your baseline is a comfortable level of activity that you can manage without experiencing a significant increase in your fatigue. And this can change on a day-to-day basis or a weekly basis. And often it actually requires a lot of trial and error to uncover what your baseline energy is. And it's helpful, one of the helpful things to do is actually to write down what tasks you find really exhausting, what tasks you find moderately tiring, and what tasks you find easy. So keeping a physical record of this is a really good way to then reflect back on what experiences you had and whether or not you can manage a certain task today or not. So for example, you might like to go for a walk with your dog in the morning. So I like to walk my dog in the morning. And if you wake up and you usually walk for an entire hour, then when you come home, you might think, oh, I'm actually so exhausted. I need to have a sleep. And you have, a 15-minute nap after that walk. And before you were diagnosed with lymphoma, you might have been able to walk and then you would go to work. But now you come home and you're like, I need a nap. Like, I'm really exhausted. So writing that down helps you to go, okay, going for an hour-long walk in the morning, I actually find to be a moderate to high energy task where I need to physically stop and rest after. So what you do then is you can come to that task and you can go, okay, instead of actually going for an hour-long walk, I might go for a 30-minute walk. And once you do that 30-minute walk, you think, oh, okay, I've come home and I'm feeling like I still have energy to do things. I don't feel like I need to have a sleep the way that I did like previously. And so then you've just downgraded like your walk in the morning from being, say, a high energy task to being a moderate energy task where you can continue to do things after it. And then making that adjustment means that you can still enjoy your morning walk, but you're doing it in a way that's not going to drain you for the rest of the day, if that kind of makes sense. And then you can do that over a long period of time with other activities as well. So every single time you do something, you can record whether or not you were super fatigued after or you weren't that fatigued. And this kind of like cataloging of your fatigue and your energy levels, you'll begin to develop some sort of pattern that you see. And sometimes this can even be related to when you have treatment. So for example, often patients will say to me that, you know, if they're having, say, maintenance therapy for their lymphoma, they might be coming in and having treatment once every 2 or 3 weeks. And they know that the week that they have that treatment, they get really exhausted for, say, 3 or 4 days after treatment. So then they know that the activities and the tasks that they're going to plan for themselves to do within those days after treatment, when they are really tired, are going to be low energy tasks so that they can accomplish them. And they're going to put their high energy tasks before they go in for that treatment during that week, so that those tasks are completed and they're not relying on energy that's not there, if that kind of makes sense. So it's all about trying to learn what's making you fatigued and then strategizing around that to try and disperse your energy in an even way. So significant increase in fatigue, then next time you reduce how long you spend on that activity, with the walk, for example, going from an hour to 30 minutes. So some strategies. So the first tip is to schedule in rest breaks. So most often when we say we're going to take a break, we don't always actually stick to it because we get distracted. But make an effort to plan small periods of rest during the day and then allow your energy levels to rise back in those rests. And these small rests spread out throughout the day are actually more beneficial than a long rest period. So often people will feel tired and so they'll go and have a sleep for a couple of hours and then feel more depleted when they get up. But if you strategize to break your day up with small amounts of rest periods, then you're replenishing your energy for the next task. And as you do that, you're actually able to get through each task as it comes. So it helps to understand what activities are important to you and what has to be done, and then what can be put off. So as we can say there, you divide your tasks into 3 categories: what I need to do, what I want to do, and what I can eliminate. So if what you want to do is walk your dog in the morning and what you have to do is drop your kids at school, but what you could eliminate is, say, vacuuming the house, then you want to get up and you want to have enough energy to take your dog for a walk, and you're going to have to drop your kids to school, but you don't have to vacuum today. So you eliminate the task of vacuuming today and put that off to a day when you have more energy. And then today you focus on doing your walk at a reduced amount, even going for a 15-minute walk or a 10-minute walk instead of what you might have previously done. And then you'll have enough energy to take your kids to school. And then when you come back, you can rest and you can eliminate your vacuuming task for another opportunity. The other thing that you could do with the tasks that you eliminate from your list to do is you can delegate them. So if you've got family, friends, support, any kind of person there that's like willing to support you and help you, you can delegate that task. So you can say that, you know, we often clean our carpets, you know, every 6 months, and I really want to clean the carpets, but I'm just too fatigued to do that. You can delegate that to a family member or a friend, and they can do that for you so that you can preserve your energy as much as possible. Also establishing a regular routine. So the body functions really well when it has consistency. So a set bedtime, also a set wake up time, and then those regular rest periods throughout the day. If your body knows that it does 2 hours of activity and then it has half an hour break, then it will grow to learn that kind of routine, and it will help maximize your fatigue levels in its own way. So you'll be like, okay, cool, we do errands for an hour, or we do activities for half an hour, and then we have a 10-minute rest, 15 minutes, we sit down. All those sorts of things, your body learns to adjust, and it can preserve energy and give energy out when needed. Also sticking to your baseline activity. So don't overpack your envelope. That's really important. Understanding how your capacity has shifted from that larger envelope to the smaller envelope, and not packing too many things into there so that you're actually not going beyond what you can normally do without becoming extremely exhausted anyway. So that's just some management strategies. We'll continue talking about management strategies as well. So knowing your body's best time of the day, week, and use this to your advantage. So high energy tasks when your energy is best. So as I said earlier, with the example of people having maintenance therapy in lymphoma, and then they might becoming more exhausted and more fatigued during the week that they have chemo, then that is knowing your body's best time of the day, week, or month. So you know that during this period of time, I get particularly tired. So this can also be broken down into a day. So you know that in the early afternoons, that is when you're at your most tired. You feel really fatigued during that period. So understanding that means that you can better manage yourself because you're aware of it. So you know that come early afternoon, you're going to be tired. So if a friend wants to catch up for coffee and they say, let's catch up, and you're keen to catch up, absolutely, you know, I'm not going to put my social engagement in the early afternoon because that's when I'm at my most tired of the day. I'm going to try and put things earlier in the day when I know I have more energy so that I can actually participate in those things and not feel drained or not have to cancel. So those low, medium, and high energy tasks can be spread out to when it's best and most optimal for you to use your energy. You can also try modifying tasks. So can they be done sitting down? So for example, I had an auntie who had really bad chronic fatigue. I think she had Ross River fever, and then she got really unwell. And during her managing and recovering from her fatigue, she actually started to do the ironing sitting down. So the ironing board, she would lower it down to a level so she could sit down, and then she would iron the clothes, her kids' clothes. She had 2 kids. And she would iron her kids' clothes sitting down. So it actually, research does say that standing takes 25% more energy than sitting down does. So if there's tasks that you can complete, like cutting up the vegetables or ironing, that you can do sitting down, then do that, modify that so that you can preserve energy for higher energy tasks or when you want to do something. So one of the good plans is to, with cooking dinner, often people say that by the end of the day, they do get really exhausted and they don't have the energy to cook dinner. So if you know that you've got more energy in the morning, then you could sit down and cut up all the vegetables for dinner, put them in the fridge, and then when the evening comes and it's time to put them in the oven, all you have to do is take them out of the fridge and put them in the oven, because you've already cut them up ahead of time when you were at a more optimal time in your day to have the energy to do that. Pacing your activities, of course, so not cramming too much into your day, as we said, not overfilling your envelope, and then incorporating exercise into your routine. So it is proven that small and moderate amounts of exercise regularly incorporated into a person's routine actually helps to increase energy levels, not decrease them. So exercise doesn't have to be super strenuous. You don't have to go for a 10-kilometer run or even a 2-kilometer walk or run. Just getting 5 minutes up and about to move your body in different ways than what you have been is a really good way of exercising. Even sitting outside on a chair instead of laying down on the bed or on the couch. So changing positions, getting up, moving about, that can also be considered exercise as well, any form of exercise. And it has been proven that short and frequent bursts of exercise that are consistent and sustainable are actually preferred to overwhelmingly strenuous exercises as well. So all of these things are just strategies. Different people find things more effective, and of course each person is going to be different, so not everyone is going to have the same process, and that's why it's so good to keep a record of what works for you. And then one of the other things I'd like to say before we wrap up is just that you need to just give yourself grace, because fatigue can be really debilitating and really stressful, particularly when mentally you want to get back to the place that you previously were. And that can be so frustrating. But I think as people, we just need to give ourselves the space to go through this and to get better and the time to recover. And it does take time. Don't rush these things. You can't put a time frame on yourself and say, well, I'm 6 months post-treatment, I need to be back to my same amount of capacity as I was before. it's just not necessarily going to happen, and you're only going to end up being frustrated and disappointed at yourself. Whereas you need to give yourself the grace and the kindness to take longer and take as long as your body needs to recover, so that you can actually live your best life. And one of the other things it's really important to prioritize is tasks that you enjoy doing. So sometimes we get really focused on the things that we have to do and the chores that we don't enjoy. And because they might be high energy and demanding, we actually miss out the things that we really enjoy doing. And that's why it's really important that you have that you plan your day and you combine things that you love doing with things that you have to do. Because things that you love doing, regardless of whether they're low, medium, or high energy, being able to participate in something that you love is going to really boost your energy and your enjoyment of life. And so if you can plan your week around enjoying tasks and completing tasks that you really enjoy, that will ultimately help you, not go crazy during the time of your fatigue and during your recovery as well. So in conclusion, fatigue it's unlike everyday tiredness. It cannot be relieved by rest or sleep. And cancer-related fatigue affects up to 70 to 90% of people with cancer. And there's lots of different causes, and every person's journey is going to be different. But the cancer itself can cause, so the lymphoma itself can cause fatigue, side effects from treatments and various medications, the length of time that treatment takes and the impact this has can also be very fatiguing. The fatigue can be physical fatigue or cognitive, as we said, so that mental fogginess, that forgetfulness, that inability to multitask, that can also be symptoms of fatigue. And remember your energy envelope. So you previously had a large envelope that could fit all the things that you did, but now that you have this battle with fatigue at the moment, your envelope is smaller and you're not able to fit the same amount of things into it. And that is okay. You just need to be aware of that, and you need to make the necessary adjustments. Divide your tasks into low, medium, and high energy requirement, and then don't overexert yourself. Use 75% of your energy capacity and save 25% for unexpected things that might pop up. Also establish a routine, delegate tasks, and modify tasks where possible. And remember to give yourself a break. So that's basically everything on fatigue there. If you want more information, as Donna said earlier, definitely visit our website. We also have the downloadable fact sheet, so the lymphoma, fatigue and lymphoma. We also have one on exercise and sleep management, because obviously sleep can be a big contributor to fatigue, and also exercise. And there's additional supportive care fact sheets available on our website. And please tune in next week for our exercise program, because it should be really good off the back of our discussion on fatigue. Look at our YouTube channel for real life stories, and our Facebook, join our Facebook group as well. And also we have our newsletters. And don't forget that you can contact us at Lymphoma Australia. So if you are struggling with fatigue and you'd like some support or to discuss that, you can call us or email us. I also encourage you to look into getting an occupational therapy review or an exercise physiologist review. So our OTs are awesome, and that's the occupational therapists. They're amazing at being able to help us manage daily activities, and particularly fatigue as well, whether that's helping you get the strength back to be able to shower yourself, or getting your energy levels to a point where you can return to work. It can be anywhere on the spectrum that you want to see yourself progress towards, but definitely seek out and get help if you feel you need it, because it's something that a lot of people are experiencing, and it is silent. It's a silent symptom, but it's not to be dealt with alone. All right, so that's it. Thank you. Any questions?
Excellent. Thank you so much, Beck. There's a few questions there, so that's great. Fantastic sort of overview and some of the strategies we can do to help, because as you said, it's probably the most common symptom for lymphoma patients, particularly either living with lymphoma, but also some of the myelosuppressive treatments that lymphoma needs to cure treat the disease, that can be really quite challenging. So yeah, fantastic. I'll just get some questions. That's all good. Our first question is from me again. My 6-year-old goddaughter is heading towards full remission after a diagnosis of non-Hodgkin's lymphoma at age 3. She's now 6 and back at school. We've noticed, and as of the teachers too, that she's dozing off at a desk about the middle of the morning, even after a full night's sleep. Is there anything we can do, or the teachers can do, to help?
So I'm just reading the question again. So your 6-year-old goddaughter is heading towards full remission after non-Hodgkin's at 3. She's now 6 and back at school. All right. And so she's still struggling with fatigue. It's not uncommon that she's still feeling so worn out. I would say that probably one of the best fatigue management strategies is just to evaluate. If you've got teachers that are noticing and her parents, then I think that probably the best thing to do would be to have some sort of family meeting about that and talk about when you're noticing that she's tired and what capacity you think she's capable of. Because as adults, we can visualize and we can self-reflect and think, oh, okay, this day really exhausted me and I need to do less in my day. But 6-year-old is not able to have the same sort of insight. And so if your family and your teachers are noticing that she's fatigued, then maybe she actually needs to go to half days of school. I work as a pediatric nurse with kids with lymphoma, and sometimes that's the case, that instead of actually going for a full 8-hour day of school, we talk to the school and we organize them to go for, say, 4 hours, or they might go in the morning for a particular lesson and then they might go in the afternoon. So they actually break their day up into 2 parts. So they attend for a couple of hours in the morning and then in the afternoon, because it might just be that a whole day at school is too much for her to handle. And in that case, we just need to evaluate what are the practical ways that we can help her. And my sister works at a school, and she had one of my patients actually at her school, coincidentally, and we worked together. And that was one of those scenarios, she said, what could the patient handle? And that patient went to his most favorite class on certain days, and then maths and science or whatever they did on the days that were most important. So if she's dozing off in the middle of the morning, then maybe she needs to only come to school after lunch. Maybe she needs to have a really long wake up period, and she needs that time. And there's actually a lot of research that's been done about the sleeping patterns of kids as they get older, and it's actually that sleeping period in the morning, like large chunks of sleeping in the morning, is actually really beneficial for their development and their capacity. So it's not abnormal that perhaps she actually maybe needs to go to school at a later time and she can just come after morning tea or something. I think that's what I would be suggesting, is looking at her overall requirements and then reducing them as practically as possible, speaking to the school. I don't know, I hope that's helpful.
Yeah, that's good advice, Beck. And yeah, it's going to take a little while for her to get over that, because it can be really, especially through that developmental phase, as you mentioned, when they're quite young, is going to have some effect on their cognitive and concentration and things like that. So she's probably struggling to really think at school, and then all the conversations are going around. I imagine she'd probably find that quite exhausting. Another thing, if she hasn't been linked in already, but Red Kite is a really fantastic organisation that have educators or teachers in their teams, and they work quite closely with hospitals, the patient and the schools, again trying to facilitate and help work out a bit of a study plan for the students, but obviously trying to keep the child as engaged in school as much as possible is really, really important. And they support people from age 0 to 25, and they're a fantastic resource. I've worked quite closely with Red Kite over the years. Another thing to think about as well is maybe looking at getting a cognitive assessment, and this is done through specialists. You get a referral from the haematologist that's caring for her as well, and these are psychologists that sort of do a bit of testing and working out their cognitive ability to help them with their studies, and which is the best way to maybe teach or give them some strategies to get through schooling, because this might be something that could affect her for a good while until she recovers.
Yeah.
Excellent. Anne has asked, how do you explain to people that you look well but still suffer side effects, example, fatigue? Very good question.
Yeah, that's an excellent question, Anne. And I think that's something that a lot of people are confronted with is, how do you explain to people that on the outside I look like I'm recovering well from my lymphoma, but on the inside I'm actually still really fatigued? And I think that it is a matter of actually saying that to people, that you said that even though I might look well on the outside, and from where you're sitting I should be completely back to normal, I am actually still recovering from my cancer experience. I'm still recovering from the treatment of my lymphoma, and I'm struggling with things such as fatigue. And so I'm going to struggle with that for as long as it takes for my body to recover. And I'd really appreciate it if you could be understanding that there's still things inside of me that need to heal and get better and recover, even though on the outside I look like I'm ahead of where I am. That's kind of the sort of things I would say. Donna?
Yeah, no, that's great. Yeah, and just people just need to that explanation, but it is really hard to say. Look, I am fatigued, because people just don't understand until you've actually gone through that fatigue. It's overwhelming fatigue that isn't relieved by sleep, and it can be quite difficult for many people to understand.
Yeah, there is also some resources on the Cancer Council website. They have some good handouts in regards to families understanding fatigue. So looking up on the Cancer Council website, I think they have some pamphlets that you can give out to family and friends, because obviously those people in your close network of relationships are probably the people that will be wondering these things the most. So as long as they understand where you're at and what you're going through, then that's good. And that might be a helpful resource to try and explain to them that you're not 100% just yet, you're still recovering.
Yeah, and exactly. And same with our fact sheets as well. I think they're quite helpful for help patients be able to explain to friends and family. It says printing off even our fatigue one and getting your family members to read that. It's just a way of validating how you're feeling too. It's not just you. Quite understanding the next one. But someone has asked, 2 years post-treatment, thank you for the suggestions. Still exhausted having showers. As you said, people see that their hair is back and they think they're well, and still nowhere near to where I am used to be. It's very hard to deal with, and it's very true and very similar to what you said before. And it's a matter of being, as you mentioned in your presentation, just being kind to yourself. And it is going to take a while, unfortunately, and there's no crystal ball that we can say, look, within 6 months you're going to be back to normal. Sometimes it's adjusting to how you're going to be feeling.
Yeah, it is really hard.
It is. Okay, Steve has had to leave for a meeting, but he'll watch his question answered later. He's an engineer by trade, but since treatment finished 8 years ago, I feel that I've lost some of the higher thinking abilities. I can do my current tasks, but any change of engineer, any tasks require that they use the higher level of thinking and processing. I don't think I can handle anymore. Is this common after 8 years? I'm wondering if it's going to be permanent.
Good question, Steve. I'm sorry to hear that it's still lingering after 8 years. It can really depend on the subtype of lymphoma that you had and the treatment that you had. Sometimes, unfortunately, with that cognitive fatigue, sometimes when patients have certain types of lymphoma, if that lymphoma gets into, say, their central nervous system space, into their brain, it can cause cognitive issues that perhaps won't recover, like aren't necessarily an expression of fatigue, if that makes sense. So I don't know what treatment you had, and I don't know what diagnosis you had, but 8 years after that, still feeling like you're struggling with these processes and these higher level tasks, I would say talk to perhaps your doctor about it even, and just ask if there was any sort of treatment or anything about your particular type of lymphoma that could correlate with your experience of this. Donna, would you say anything?
Yeah, I'm also actually quite familiar with, I know Steve. So I know Steve has actually had 2 transplants, an auto and an allograft. So has had considerable out, and pretty much what you said before, Beck, is depending on the type of treatment you're having, and especially the higher intensive treatments, what you would have had with both of those transplants, and he's also had other multiple treatments too. It can really take effect. And look, 8 years down the track, unfortunately, quite often they say with fatigue can be like a 7-year sort of cycle for a lot of people. If it's really quite intensive treatment, or they've had a really nasty virus or something, it can take a little while to leave the system. But when you've had that intensive treatment, that your immune system's been so battered, and extensive treatment, that sometimes it's a matter of trying to work out some of the strategies that you mentioned earlier, Beck, and how that helps you to adjust and adjusting to a new normal, and what can get you through. Another thing is to try and maintain your current level of cognitive and processing ability as well. And I think obviously an engineer, you're in a pretty tough job and having to think and problem solve. So I imagine you're giving your brain a good workout. But for those who aren't working as hard, sometimes just keeping your brain active will help you in later life by doing crossword puzzles or things like that. Just trying to keep your mind as active and thinking as possible can help the outcomes as well. And also an early stage post-treatment too, I encourage people to try and use their brains a little bit more, and reading, or even a short amount of reading, and slowly build it up can help for later life too. But yeah, no, really good question. And yeah, it's a tough answer. And again, maybe a psychologist, a specialist psychologist, these are, who can do these assessments, cognitive assessments. They might be able to help with some ways of dealing around that, depending on what the damage would be. So yeah, great. I think we've answered all the questions actually. If there's anything more, we can probably take off. Thank you so much, Beck, and thank you everyone for tuning in. We're getting really great responses from these sessions, so please let us know if there's any topics you want to hear about. We're working a couple months in advance now, and we will be sending an evaluation form, so it's really great to hear your feedback and how we're going as well, so we can help improve and hit the mark. But thank you so much for tuning in today, everyone, and have a lovely day.